actually, and it's time for Take Charge of Your Health with Corinne Furnari. Please stay tuned.
Hi, this is Take Charge Your Health with Corinne Furnari, clinical nutritionist, physician assistant, and Carol Peterson, pharmacist. Listen, learn, and I hope you enjoy the show. Bye.
Welcome back. This is Take Charge of Your Health with Corinne Furnari, clinical nutritionist and physician assistant, and my co-host, Carol Peterson, pharmacist. Every week, we present you with new and creative ways to help you make sense of health information and bring it home to you and your family. With years of clinical experience between us and research into traditional and cutting-edge technologies, we give you practical information to help you take charge of your health. Welcome back. Welcome back. We're here. We have a very special show. Carol is at a conference, but I have a very unique doctor here with us to share the show with us. Now, let me start out by saying right now we're right on a precipice in that we're standing on the edge of a totally new form of medicine. We're going to
I cannot
fall
hear
off
anything. Did we start?
into a
Jeremy?
wonderland of
I
we're
can't
going
hear
to fall
anything.
off into a wonderland of totally new medicine. We're having a few problems with the sound. So 1 second, we'll get her going. But let me finish my entry. And
I
what
can't hear.
happens is that what we're talking about are peptides. Peptides are a whole new concept of medicine, a whole new understanding of the body and how the body works. And so today we have an expert who specializes in peptides, stem cells, exosomes, and alternative therapies. You've met her before, and she specializes, the interesting part, she specializes in male medicine, focusing much of her efforts on males. So we have on this show, I think, underserved males. Can you hear me now? No, not yet. Let me see if I can do anything. I'm just typing it in. Let me see. Nope, not yet. So let me continue. So what we're going to talk today about is peptides and how they affect males and the male sexual experience. Now, what happens very often is the fact that whenever we talk about sex, we have to snicker or whisper or talk with a wink. But today, that's not going to be the case. We're going to be speaking about male sexuality, and it's going to be very direct, very frank. But I'm going to start it off with a joke. And that joke is that there was a gathering of senior citizens. There was a gathering of senior citizens, and what happened was the gentleman running the meeting asked the senior citizens raise your hand if you have sex once a week. So one guy in the corner raises his hand, and then he asks, raise your hand if you have sex once every 2 weeks. And 2 men raise their hand. Raise your hand if you have sex once a month. And more men raise their hand. Raise your hand if you have sex once every 3 months. And some men raise their hand. Then he finally gets to the last and he goes, raise your hand if you have sex once a year. And someone in the back raises their hand very enthusiastically, waving and smiling. And the moderator looks and says, you're having sex once a year. What are you so happy about? And he said, tonight's the night. But what happens if tonight's the night and you can't perform? What happens if tonight's the night and your desire's there, but the plumbing doesn't work? So that's what we're going to be discussing today with Dr. Bar, and how she treats her patients, and how a whole new science has developed in working with men in terms of their sexuality, sexual response, their muscles, building their body, their muscles, their circulation. Now, Dr. Bar, are you with me?
Can you hear me?
I can hear you perfectly.
Oh, finally, thank
Yay.
you.
Did
Finally,
you
we're connected.
did you hear my joke?
No, I didn't. Sorry, I just got in
Oh,
right now.
boo-hoo. Okay. I thought you were going to love it. So what I was telling the audience is that today we're going to be talking about males health, male sexuality. You know, we have a crisis right now. We have a crisis in testosterone, where it has lowered more than 50% since 1970. And we have an even greater crisis in sperm count, which has gone down significantly. Dr. Bar, can you explain that to us?
Yes, unfortunately, it's like every decade now we're getting the sperm count lower and lower, and we're seeing this as almost like at an alarming rate. And the levels of testosterone, unfortunately, has declined for so many environmental factors that nobody is talking about or concerned about for some reason. So, number one, our young population and males generally are very stressed than before. So they're and the stress is not well controlled as we were able to do before, probably. And then the environment toxins that we're exposed to, where it's plastics, the hormone blockers, the pesticides, all the things like soy in the food, the additives. So unfortunately, hormonal changes has been happening over the years, and that's affecting the male sex hormones. So instead of the males having more testosterone, it's declining over the years, and they're having more estrogen like hormones. So we're
Effects.
finding this
Hmm.
to be a problem as we just go through the years now.
We
We've been
physically
practicing over 30 years, right? Both of us. So we're seeing
mhm.
this real life, right?
We physically see this when we walk down the street. We see this in the men, in the way they walk, in their body shapes, in the fact that they have t-shirts on. You can see their breasts. Their breasts are developing. You can see their bellies. What you're seeing is not someone that just doesn't take care of themselves. You're seeing a hormonal shift that's affecting our whole society. And Dr. Barr?
Another thing we maybe need to address, like we have noticed also obesity is on the rise. And obesity, we know the fat cells are the ones that are also producing more estrogen in males. So then we're seeing the estrogen dominance in male more than the testosterone. And humans are, females or males are the same. We have the same hormones. It's all about the balance, who has more testosterone
Mhm,
than the other.
mhm.
But
We forget that.
yeah, obesity is another kind of epidemic we're seeing, like people with, even young people with visceral fat that's showing like a little pot belly coming out. And that's a problem because, that's creating more estrogen than the testosterone that they're making.
So we will be going to the audience because I know you're going to have questions. Once you start hearing about what we're talking about, I'm going to give you the phone number right now. It's 212 209 2877. It's 212 209 2877. But Dr. Barr, how would you start? Tell us how you would begin.
So, if we want to like really identify the issue of testosterone, for example, which we see young men coming now, in our clinics and, kind of having their common symptoms now as fatigue. They go to the gym and they're not getting gains in muscle. They cannot sleep too well. They're like always like having imbalances in their sleep. They are gaining weight around the waist, mostly like the toxic belly fat that we know. And again, the last thing that they usually complain of, because that's the last one to go, is usually affecting their libido or their sex drive at some point, because that is the last to go. So the most important thing I would say when they come into our practices, we need to address their symptoms and see if there's other underlying causes. But if there's none, we need to, even at 30 years old males, starts checking for testosterone levels. Don't you agree?
I I totally agree. As a matter of fact, when people walk in my door, a male walks in my door, I check all their hormones, right down to from pregnenolone, DHEA. I do cortisol first thing in the morning. I do testosterone free and total. I do sex hormone binding globulin. And I also check their thyroid and then look at their cholesterol, of course. They couldn't walk out the door without a cholesterol check because that's the most important thing to anybody else that they will see, which I don't agree with that, but I believe it's important also.
You're hitting a hot topic because everybody wants to lower their cholesterol, but it is the most
Oh my
important molecule.
goodness.
Maybe we should show it on some time, like maybe at the end of our video, we should show the importance of cholesterol and vitamin D, those two steroid molecules that will make all your sex hormones, will make all your adrenal stress hormones. So
Well,
without stress hormones, you cannot handle stress. That comes from cholesterol molecule and vitamin D. And then also all your sex hormones are coming from cholesterol and vitamin D. And I'm so surprised. Everybody now is put on statins. The
oh my
standards of
goodness.
putting people on statins is unbelievable. And they drop the cholesterol where those people are not able to make hormones anymore.
And they feel depressed.
Yes.
And they have muscle pain and
Hmm.
et cetera, et cetera. It goes on and on. They get forgetful.
Yes.
They can't focus. It's difficult for them to focus. This is very serious, this forcing of cholesterol down. And I've even heard a cardiologist say, if I had no LDL, I'd be happy.
Well, LDL is good to watch with your food, and you can lower it, but you don't have to lower the whole cholesterol molecule that is like a
Exactly.
synthesis of all your good hormones. So, unfortunately, yes, you're right. Like the brain needs fat to function, and it's
And
not
it,
sugar, it's fat. So, if we deprive it from fat, people are fatigued. It's
and we need
unfortunate.
the LDL to create the myelin sheath to protect the
Yeah.
nerves and the
Yes.
neurons. So, I mean, we've got a very important circular protection in that process there. And so we just have to understand how to manage it. And we can manage it very often by cutting out sugars, not eating late at night, by cutting out heavy breads. This is very manageable. And so, but let's go on.
Well,
I'd
you
like to
mentioned
talk
some.
about, go on.
Yeah. No, because like the night cravings, and I know you love progesterone, but what are your thoughts on the night cravings, the sugar cravings that want to have ice cream at night? Don't you think progesterone helps that?
I think it does. It helps calm it. Oh, yes, and I
Hmm.
also it helps calm it. People feel calmer on progesterone. They just feel
Yeah.
that it's almost like their life levels out, their emotions level out, their ability to sleep increases. And progesterone is not just a female hormone. Just
Yes.
like you said in the beginning, it's not the hormone that's male or female, it's the amount.
The
They're all the
balance.
same hormones in men and women, and that is an important understanding that we should have in dealing with ourselves and our bodies.
It's all about the balance. So I think it's very important to measure all these hormones. Unfortunately, sometimes you go to your primary care and they just check only testosterone and that's it. And they're not doing the free, the bioavailable. So we can list all the other hormones that are important because they all run between one to the other. They go back and forth, right? And again, it's very important because testosterone will make estrogen. And that is important for estrogen is important
Exactly.
for females. So we need to measure all these levels and find out how one hormone goes into run into the other. As we age, there's the pregnenolone or the cortisol steal, right? Like that's how we end up having the gray hair. So instead of making sex hormones, we get into the stress hormones, the adrenal hormones. It steals that, and then we're doing less and less sex hormones and making more of the cortisol that actually ends up causing the gray hair and the aging and the aches and bone problems. So I think it's important to check for all these hormones at a young age and making sure that you're not just checking for one ingredient, you're just checking for the whole panel. And then what are we going to do after we find out, like, if
And
somebody's having low levels?
well, uh, in the last few months, I had 3 men in their early 40s with
Hmm.
a testosterone level in the hundreds, single hundred, 110, 125, 190. 3 men. And that they came to me and said, "Well, I want testosterone. I need testosterone." And I agreed with them. They need testosterone. But if I gave them testosterone while they're all inflamed and overweight, they're just going to convert it right
Yeah.
away to estrogen. So there are
Yes.
these clinics all around where men are going, and they go in, they see a nurse, they get a shot of testosterone once a week and leave.
Hmm.
And that's it. They're
And
not
I
being
have a beef with
followed
this
for
one.
insulin.
Yeah, I have a problem with that. Yeah.
Yeah, they're not being
Yep.
followed in any way for they're followed for testosterone levels, but they're not being followed for the conversions. They're not
Hmm.
th- they're it's total inadequate care. And guess what's happening? And you said it to someone recently. That's almost like a chemical castration. Can you
Yes.
explain that to us, please? I'm
Sure.
going to give the phone number 212-209-2877. Go on.
So, a very important note here. So, when you get a patient with low testosterone, they should have also symptoms. So, I'm sure those hundreds, which is like below 300, we consider it low as a total testosterone level. So, those guys at 100, I'm sure they had symptoms, but it's important to ask the patient if they have these symptoms that we discussed in the beginning that indicate there is a low hormonal problem. Because if somebody is in the low, like in the 400s, but has no symptoms, maybe we need to measure it twice. We like to measure
Mm-hmm.
it maybe twice before we confirm if it's really going down or what is the problem. So measuring twice, and then also confirming that the patient has symptoms that is matching the levels that we're finding. So when they're young, we have to be very careful. When young men come in, we prefer not to give them testosterone directly because that is shutting down your machinery in the brain and shutting down your system. That is overkill for a person. So young men should consider other options than taking exogenous testosterone in a shot or a cream, or even some people put pellets in. So we can talk about that at the end. But I think it's important to make sure that we can actually stimulate their own body to bring the testosterone back. And that is through either improving lifestyle, getting their sleep better, changing the nutrition and making sure they're having the right ingredients to make testosterone, like nutrition, zinc supplements, vitamin D, cholesterol is available, but also that they're sleeping, they're exercising, and they're reducing that amount of fat. So if they're obese, that's lifestyle changes. Then instead of giving them testosterone, the first step would be maybe trying to do stimulating their brain through peptides or through molecules that help your central nervous system, which is we have the central brain sends signals to the testicles saying, please produce testosterone. So a lot of times the testicles are still functioning fine, except like the brain is like kind of sluggish a little bit. And that's what we need to nudge and say, hey, let's produce more. That's when we can use like human chorionic gonadotrophin, like peptides like gonadorelin or kisspeptin, for example. Some people also heard about HCG, and that would be great because we will be able to produce their own testosterone. But also, when people take too much testosterone, as those clinics you're talking about, just give them once a week shot, they're getting a spermia, which means they're not producing any sperms. They're shooting blanks because they're suppressing that process. So that is why I call it chemical castration. So those men are taking testosterone in that clinic going every week, and they're hooked for life. They'll take those shots forever, and they will not be able to have, you know, sperms. And if that's an issue, it's going to be infertility and castration, basically, and as well as the cosmetic stuff that happens, right? When
Oh,
you take too
yes.
much. Yeah, shrinking of the the testicles
Testicles.
shrink, and pruning, and not producing any sperms. That's a hard one.
Now, I used to use regularly, well, when I needed it, HCG to
Hmm.
balance testosterone. And I use it in women also because I used to say it was similar to an endocrine reset. It was
Yes.
almost like I'm very visual. So it was almost like you walk up to a skeleton in a biology room, and there are all these bones all over, and there's the string out of the head of the skeleton. You pick it up and shake it, and there's a perfectly formed skeleton. Well, that's the
Yeah.
way I saw HCG working
Yeah.
with our endocrine glands in terms of balancing them and getting us healthier by
Yeah.
using it. And so I found that HCG would build testosterone levels, um, quite often would double them and triple them,
Hmm.
and people would feel better. What?
100%. It's a feel good hormone. Absolutely. And testosterone is a feel good hormone. That's why it's a controlled substance, right? It's a classified controlled substance, and people should go to a certified physician or somebody who's legally able to give them those prescriptions, because otherwise, actually, it's like taking drugs.
Yes, and what happens is more is not better,
Hmm.
which
I,
people don't understand that. They think more, more, more. It's not better. The right amount is the best. And maintain, slow and steady, even amount is the best. But now, can you explain to us about peptides? Many of us don't understand about peptides, but we have one listener. Let's go to the listener, and they have a question. I knew we would get some questions. Hi, you're live. Your name, please.
Uh, yes, Frank.
Hi. Can you speak directly into the speaker?
Yeah, hold on one second.
Oh, this is a fast moving show. Come on, help us out.
Yes, doctor. Thank you for taking my call, and I just want to say I listen to WVAI, and it's a very informative channel. Just two questions.
Yes.
Is a natural way of enhancing your testosterone, producing testosterone with the supplements? Because there's so many supplements out there, and I've taken quite a few different kinds, and it always comes down to tribulus. Is that a major factor and an ingredient to produce testosterone for males?
Well,
Another question.
Okay,
How do
and then
you,
go on.
I'm sorry.
Go on.
No, how do you stop early ejaculation, in males? Is that something that can be, uh,
Addressed?
yes.
Yes. So I'm going to ask you to hang up because, yes, we will be addressing that. That's one of the treatments that Dr. Barr has in her clinic. But tribulus, what I've seen of tribulus, maybe Dr. Barr has a different relationship to tribulus. Tribulus is like an endocrine reset. It's more for the whole body rather than just testosterone. It kind of balances the endocrine and stimulates it, at least what I've seen. When I'm looking at attempting herbally to bring up testosterone, I look at tongkat ali
Mhm.
or catuaba from Brazil or horny goatweed from
Yeah,
Jamaica.
yeah.
So, what do you think about tribulus, Dr. Barr?
So I made a pill
Uh
for
huh.
stimulating testosterone, and I use it for younger people because, like, a lot of times it's good to try to stimulate by either my I'm gonna give you my favorite one, but I do use Stankat Ali. I use Tribulus. I use um, uh, fenugreek. I use horny goat. So I add all these together, and some of them also have the benefit of being an aphrodisiac or helping with libido, right? But they're not going to raise your levels of testosterone to where you sometimes feel that it's getting. So there's supplements, and unfortunately, you cannot have a regulation on all the dosage, and everybody's putting a number there, but sometimes you might not. I don't see my patients going to a high level with that. But the one I really like, which is considered a supplement, is DHEA, which I added into
Yes.
my pill, and pregnenolone. So, as we said earlier, like the molecule progesterone will be making pregnenolone, which is the mother hormone that will make all the other hormones on either side, your stress hormones and your sex hormones. So, I measure it, but all my patients can take it because it's a supplement, especially young people, instead of putting them testosterone. So my first step, doing the pregnenolone, DHEA, Tongat Ali, tribulus, horny goat, zinc, vitamin D. I also add a little bit of citrulline and L-arginine, astaxanthin, which is an antioxidant. Ashwagandha is another one that's been studied for
Wonderful.
balancing and great for mild ED, but also raises testosterone. So all this, I gave you my recipe, my secret recipe. I gave it online, but that is my recipe, and I made a pill. I call it TRX, and all my young people who are starting to have issues, before putting them on hormones, anybody, you know, 55 and below starts on that.
Oh,
And
55
then,
and below is young people.
yeah, yeah,
Nice.
the young people. I have my oldest one is 90. Okay, everybody's having fun. Men have to have fun. So,
So, what
yeah,
are
so you can.
peptides?
Okay, so let's answer his other question, right?
Oh,
Because he had
yes,
another
yes, yes,
question.
yes. I'm sorry.
So, unfortunately, this is an ED problem. So we need to find out the reasons of ED. It's very common, right, to have that. A lot of times it's vascular or a nerve issue. For early ejaculation, a lot of times if it's nerve issues, you might consider one of the things that I like to do as a treatment for that is actually my P shot. The P shot is a shot that we do PRP, extracting some
That's
of the
platelet
blood.
rich
Yeah,
plasma.
extracting the blood, spinning it down, and making platelet-rich plasma in a vial, and then injecting that back in the penis that is numb. And the beauty of it, it has a lot of vascular stimulants, growth factors that can reverse the aging process that happens and creates the ED for the nerves and the blood vessels. And that becomes like it's a 30 minutes procedure in the office, really. You numb and you take that shot. And it always helps with so many different. early, late ejaculations, different with like different issues with sensation. Even when people have the venous,
Yes.
kind of leak where they move and then they lose the erection, or the erection is not too strong, weaker, that doesn't last too long. So all these are really a great kind of way to treat it with P shot, which is one of my favorites
I'm going to tell
procedure
a,
for men.
I'm going to tell a little secret. I was looking on YouTube and I saw you explaining the pea shot. It was hysterical because you
Cucumber.
took a small cucumber, a teeny little cucumber, and you showed in a cucumber how the shots would be, and the end result was one of those giant English cucumbers, and that and then you said, "Well, we need realistic expectations." That was so funny. I said, "Oh gosh, I got to bring it up." So go. Let's go back to peptides. Do
Yes.
peptides play a? Can they play a part in this in helping our men and all of us?
Yes. So peptides are really um, great because they are available now for us to use them in our practices. They are less expensive than using, like, for example, growth hormone. Instead of using a growth hormone, now you can use growth hormone peptides. You can use sex peptides. I love kisspeptin. HCG is expensive now. It's like, it used to be like compounded and cheap. Now at least it's like 390 to get that from pharmaceutical, and it's usually not covered unless somebody has infertility. But peptides, the shot can be like $100 or so it's like a fraction, or 150. These injections are just easy. You can take them at home too. They're very small, teeny shots. They're made of protein, so you cannot take them orally. I love kisspeptin, is one of the favorite peptides for men, especially younger ones, that we don't want to give them external testosterone so that their body can make it. So men can make testosterone till a very late age. So it's faulty to think that they can't. So, if you stimulate their testicles, it will work, unless if they have an injury or a tumor or a brain tumor. That's when they have a problem. But than that, you can still stimulate the testicle. You might not get the same result at a 20-year-old through peptides, but you will raise up maybe 200, 300 levels up. So when you measure the patient's testosterone and it's low, below 300, you check for the bioavailable and the free. You want it 50 and above. Then you want to actually supplement them so that they can get something to stimulate the brain. Kisspeptin is one, it's injections, or gonadorelin is another peptide that they can use. These are really cool peptides because also they enhance your mood, they help you with building muscles, it helps you with your energy, it's great for your sleep. So again, these are really cool peptides that actually work along the, you know, broad spectrum, but also they do not inhibit your sperm count. So for young people who still want to have babies, they do not have a problem with the sperm count. But also men sometimes do not want to be shooting blanks and they want to see that they have an ejaculation. I find that they get upset when they have like zero sperm and they're not having good ejaculations. They come and they're upset. So we see a lot of people that are on 200 milligrams of testosterone once a week. They're injected, or they got the pellets for 6 months, and now they're losing hair. They are Libido is low because too much testosterone will tank your libido. It will increase your estrogen, it will suppress your libido. So, and then they think, oh my god, I need more, they go take more, and then it
Exactly.
gets worse.
Exactly. Yeah.
Yes.
So more is not better. Not at
Never.
all.
And then,
So
you mentioned something like it's going to turn into estrogen, and what does that do for the prostate?
creates inflammation.
And eventually inflammation
It
becomes prostate cancer. So that's
eventually.
the scary part. So
Hmm.
that's why we check for PSA. But when I get those men who've been on those clinics that they go and give them 200 shot once a week, which makes only a problem of your raising up
And
and
then crashing
peaking and
down.
tanking. And then when you have that high level of testosterone, guess what? It's going to move into estrogen, right? Estrogen, the estradiol and the estrone. Estrone is the one we worry about cancer. It ends up causing problems in the prostate. And these guys have two problems. One, prostate cancer or prostate hyperplasia. Two, man boobs. You mentioned it earlier.
So how does the kisspeptin work? Does it works on the brain? It
Yes.
works in the pituitary, but
Uh-huh.
it stimulates LH and FSH.
Yes.
So it's all indirect. It's not direct.
So, yes, it goes
Mm-hmm.
from the brain on the hypothalamus, the big center, goes down to the pituitary, the center below it, that has all the hormones in charge of all the hormones. It sends FSH and LH, follicle stimulating hormone, luteinizing hormone. And that's the difference between the kisspeptin and testosterone, because it will go down from the brain to your sex organs and it will stimulate it to produce, to goes to the testis and says, let's do sperm, and goes to the testis and says, let's have testosterone, right? A trivia about the kisspeptin, it is those little kiss chocolates?
Mm-hmm.
It's tribute to that kiss, from Hershey's. It is. It was discovered, and they thought that would be
Uh-huh.
a good attribute to that. Kisspeptin is from the kiss chocolate from Hershey's.
Now the gonadorelin.
Mm.
Now, how does that work similarly?
Yes.
So what
But it's
is
not, it doesn't work on both. So gonadorelin would be fine, except it will increase testosterone more than the sperm. So kisspeptin works on both. HCG work on both. If you're worried about the fertility and spermogenesis, I think it's good to do either HCG or kisspeptin.
so wouldn't do the two together?
No. No,
Okay.
I would do the peptides so that's how I would treat my patients. I would start them on DHEA, pregnenolone, of course, after measuring, optimizing those two levels, right?
Mm-hmm.
And making sure their vitamin D is good, cholesterol is good, the
Mm-hmm.
supply, right? Zinc is good.
Mm-hmm.
And then I would give them a peptide, which would be possibly kisspeptin, my favorite. And if not, depends on pricing as well and availability, because sometimes whatever's available um, is it's an issue. So a lot of times we did not have HCG in the market; it was not available. So now
Mm-hmm.
we have options to do the peptides.
Now I saw there's another peptide, PT141. Help me
Yes.
out on that one. And there's a comparison. You do a comparison between
Yeah.
PT141 and Viagra. But let me give out the phone number, 212-209-2877, 212-209-2877. I know you have questions. That's not even in a doubt in my mind. And we have a caller. So, hi, you're live. Your name, please. Hello? You have to, yeah, you have to speak into the speaker.
Yeah, I am.
You- Okay. Your name, please.
I can hardly hear you.
Your name, please.
James.
Hi, James.
Hi. I have three quick questions. Where does Dr. Barr practice? Has she written any books? And what number of testosterone is healthy? Or I'll hang up and listen.
Thank you.
Well, thank you for the question, James. So I'm in California. I practice in Southern California. And I used to practice in Nevada, but I don't do that anymore right now. So I'm in California. And I've published on stem cells. I published some papers long time ago when I was in university, but now I can tell you, and I have a book that I'm trying to publish. That's a really tough one to publish because it's not that easy, but it's about the penis, and I hope that is published soon. I'm working on it to find a publisher, but my published book is about biohacking, and it's for longevity, anti-aging, and stem cells. So how to biohack your stem cells. It's on Amazon, and I had somebody who helped me. Thank you, Jeremy, for doing that. Who's our amazing person on, we're not that techie, but we try. So that is my published book. I am trying to publish my book about the penis and men's health. So that's hopefully coming up soon. It's finished, but I'm working on the publication. Now, the third question was, sorry.
I went blank just now too. He asked about I forgot. I'm
Okay,
sorry.
sorry. We'll probably remember.
We'll remember in a second, James. We'll
Yeah,
get back to that
yeah.
question. And sorry.
It's
So
just too many questions.
so you were going to talk about PT 141.
Yes, and hopefully James come back again or send us a
Yes, he
message.
will.
I don't know if he can send us a message there. He can send us on the YouTube a message, right?
212-209-2877.
Thank you. So PT 141 is a really fun peptide, and it I think it was discovered maybe in the 90s sometime, and it was created through the melanocyte. So we have a receptor in our brain, melanocyte stimulating hormone, that actually can tan us, give us a tan. It was discovered that time because when they did this like work, the people got a tan, but they also got erections. Isn't that cool? And got stimulated and higher libido. So it works for both females and males, and it works on the brain. So the difference between PT 141 as a peptide and Viagra works on people because it works on the circulation. So for a man to get an erection, he gets a visual, for example, the brain sends signals to produce nitric oxide. Nitric oxide goes on the tubes in the penis to stimulate the blood flow. It's all about engorging those two tubes, cavernous sinuses, with the blood, and that's why the penis get erect. I have a video on YouTube that has like over, I don't know, thousands of hits, because it's like a 2 second showing how an erection is made, right? And then once the erection is made, the blood stays there. So we need our blood
Gets
vessels to bring
trapped.
the blood in, yes, through nitric oxide, good blood
Mm-hmm.
vessels. And then blood vessels keeps it in, that's your veins and the valves, to keep this nice engorgement in, so the erection stays until ejaculation happens and everybody's happy. And then the veins open up and release the blood back, and then everything is over. And that is controlled by vascularity. And Viagra works on blood vessels. So it was discovered by mistake. They wanted to use it for cardiac. Some pharmaceutical company thought it's a great,
For
cardiac kind of
circulation.
monitoring for the blood vessels. And as a
Mm-hmm.
side effect, they find all those guys with erections and happy and having fun and wanting to get some more of the, study. So basically, they found that by mistake that Viagra blue pill is going to make them billions and billions of dollars, because you know what? Sex sells more than, who cares about my cardiac health?
Hard.
So yeah, so Viagra works that way. PT 141 works on a totally different way. So that is awesome, because not every ED is because of blood problems, right? Most of it is blood problems. As we age, the circulation is poor and the blood vessels are weaker. But sometimes there is something called psychologic ED, meaning like it's in the brain, right? So if somebody cannot get it on first time, we say, don't think about it. It's going to be okay. Next time, try it again. However, if it's repeatedly, they have issues and they cannot keep their erections because of a psychological problem. PT 141 works amazing. So it increases the libido, it works on the mental stimulation for erection, and also females and males. So females don't get erections. However, the females also get stimulated for libido. So it's the one peptide like everybody wants off the shelf when they come to the office. They want PT 141 for their weekend vacation without the kids. PT 141 is amazing because great erections, great libido, right? And at the same time, it is just really very easy to use. Most
How
peptides we inject it. Yeah, go ahead.
and PT 141 is it injectable?
Yeah, but now we have it also as a spray. So those guys can take a spray over the weekend with them for trips versus having to take a shot.
How long does it take to work?
Okay, so that's the trick. I just had a patient in my office. Everybody is so different. So it is so important to try it out first. So that patient, he's a young guy. He said, I need it. I have a date. I need it in the office. Give it to me because I'm going to have my date in 2 hours. I said, listen, I give you the shot if you want it because they can take it as a shot or a spray. However, I don't know when you're going to have your erection. It could happen like he's driving back for an hour. He came to see me an hour away. He drove from San Diego to Orange County to see me because he has a date. So I gave him the PT 141 and I said, I don't know when it's going to work. Take some more with you because we started low dose. I don't want him to have like walking into the date where he's having like a problem. And I said, you can have a little bit more. So we gave him half a dose and then gave him the rest so that he can take it with him. So they can gauge it. So any patient takes it, and I say, please do it when you're preparing for a fun night, weekend, whatever it is. If you don't know when it's going to start, maybe it might take 1 hour, it might take 2 hours, might take 40 minutes after injections. They say that, but everybody's different. Depends on how much the circulation, their ED issues, all the other stuff. So if they have other ED issues, it might not work right away.
That's PT
Yeah.
141.
Yeah. And then I
Now,
tell them also don't do it too late because you know what? You might get an erection past midnight and everybody's
and
asleep.
you're
What
already
do you
home.
everyone else?
Well, what about how long does it last?
It's variable from 1 to 4 hours. But the beauty, and again, I tell people if it lasts more than 4 hours, take Sudafed, the good all generic Sudafed, because prolonged erections can be very
And not
painful
healthy.
and
Yeah.
dangerous.
Uh-huh.
Priapism.
Mm-hmm.
And that's an ER visit. If somebody has, it's a bad side effect to have a hard on for 4 hours. Some people like to have fun for hours, but not 4 hours. That could
Not
be
4
dangerous.
hours. No, no,
No.
no.
So if it lasts a very long period, that's where we ask them to go to the emergency room or take Sudafed. Do you have somebody? Do you have
No. The number to call 212-209-2877. That's 212-209-2877.
And I
And
really
we'd
hope
love to hear from you.
I hope James send us a message after we're done, maybe on the YouTube channel. I hope
So
so.
now I was reading about the peptides. One, supporting our energy, our
Mhm.
mitochondrial energy. Oh, we
Mhm.
do have a caller. It's probably James calling back.
Oh, thank you.
Hi, you're live. Your name, please. Hello?
Hello,
Hi, your name, please.
James.
Hi, James. Thanks for calling back. What was your last question? We went blank on it. We're so
Yeah,
focused on all
I just need to hear the name of the book that she had already written.
Biohack Your Stem Cells. It's on Amazon. Maybe we can, I don't know if we have links or that they can send us messages and we respond at the end. Biohack Your Stem Cells. It's on Amazon. Let me see if I can get it on
And
my
what
phone.
is
No.
how do you spell your name?
Bar, B-A-R.
BAR. It's right there. BAR, one R.
Okay.
And
What's your name?
IMAN.
I'm sorry, what?
I-M-A-N. Iman Bar. Dr. Iman Bar.
Okay.
Okay, we have
What's
another
the name of
caller.
the new book coming out?
That's it.
Yeah. The
That's
other
it.
book, the name is It Can Be Hard.
Okay. And the question that you missed was, what are healthy numbers of testosterone?
Oh, yes.
Oh,
Okay.
yes. Yes, and
So
we should have talked about this
it's
earlier too.
very
Thank you for
interesting.
asking.
Yes,
Do you
very
want to go over that,
interesting.
Corinne?
Yes, I'll start it and I'll pass it to you. When I was in training in school, the numbers were 450 to 1200. That was normal range. Then now it's in the 280s to 700 in many cases. So what they've done is they've dropped the ranges to balance with the fact that we have an older aging population and a less healthy population. If anybody came in at 1200, there'd be a big red mark on the blood test showing that there was something abnormal. Dr. Barr, what do you think? And we have three callers.
Okay, so I think like 300 and below for total testosterone is now like considered low, but also we want to make sure there's symptoms. We like to measure, anybody doing testosterone has to measure also bioavailable and free. And the importance of these is very important, as well as sex hormone binding globulin. So, bioavailable testosterone is available in your tissues, but it's lightly bound to albumin. However, the free is what's not bound to, like the globulin is the other one, sex hormone binding globulin tightly binds to your testosterone. So it's a very small amount, like, one third that is bioavailable that does the job. It's not the total testosterone that does the job, because a lot of that testosterone either is so the 1200 that Corinne is talking about might be, part of it is carried on albumin lightly and can be dissociated and do the job, but the rest of it is tightly bound to globulin that also is very difficult to dissociate from it. And basically, that globulin is very important to measure because with age, the levels can go up and down, can change with
Now,
age, with obesity, with thyroid problems. That's why we check thyroid problems when we
thyroid,
check male, yeah, hormone.
with the fact that
Also,
people are on
A1C, so
statins.
diabetes would affect it. So that's
Hmm.
why the numbers are important to measure all your parameters, not just total
Now,
testosterone and focus
we
on that.
we have three callers.
Okay, let's do it.
This happens every
I
time
go
in
right hands.
4 minutes.
Mhm.
So, hi, you're live. Could you please speak rapidly and ask your questions? We'll see if we can
Yeah.
get it answered.
Hello,
Hi, your name, please?
John.
Hi, John.
Yeah, I'm calling about something which is sort of different, a little bit different than the program. I have on Lupron, and
You're on
Lupron
Lupron.
is a medication that reduces the testosterone in which prostate
Mm-hmm.
cancer feeds on. So the response from the doctor is that by having the Lupron, which absorbs and lowers the testosterone rate, is also lowers the PSA. So understanding the conditions of what physically what that does to one, I'd like to know overall, being that I'm able to have the PSA lowered, uh, and being able to deal with a low rate of prostate cancer, what are some things that I should do aside from the sexual element of it to maintain my overall health and well-being? I've heard you talk
Okay.
about
We have
right
literally,
sexual,
I'm
I'm
sorry,
talking about.
we have 1 minute to answer your call. So I'm going to pass it right to Dr. Barr, and then you're going to have to speak quickly, and then I want your website.
Okay, so maybe, and I've already talked about the Lupron or finasteride. Finasteride syndrome is concerning. Unfortunately, a lot of the doctors now do not even look for the reason why your PSA was high, if your prostate has issues, if you have cancer. So you need to look into certain other things that are important, not just to block the hormone. You need to reduce your estrogen amount. It's so important to do that instead of doing just the finasteride. because there's a lot of side effects with that, and it's going to reduce your testosterone. So look at other natural options other than using the
To
Lupron.
to support what you're doing, not
Yes.
to exactly.
Yeah, sorry.
So
Yes. Yes.
yeah, to
So there are
support
other
what you're
healthy,
doing.
natural,
Many
other ways of
things.
doing that to reduce the side effects that you might get from Lupron.
So, Dr. Barr, what a fun show. Now,
Yes.
our poor gentlemen, we have neglected them. We have not been able to focus on them in a way that we really wanted to. So, having you here, we've been able to focus our program in that way. So, I want to thank you for being with us. Could you
Thank you.
give us your website?
So it's DRBAR. I'm only one R. I'm not the Dr. Bar with the double R, like bar like drinks. X DRBARX.com. And you can send me messages there if we missed any of the questions, if we want to expand on them. All my social media is there, whether it's YouTube. I talk about the Lupron and the side effects and all that information and other options to avoid it or to use other alternatives. I have those on my YouTube. I discuss a lot of the issues. But if you have any questions, you can send me a message there as well, and I will do my best to answer. DRBARX.com.
And excuse me, I'm Corinne Health, CORINNE Health.com. I also have answer questions, but through our Facebook mostly, and that's Take Charge of Your Health, excuse me, with Corinne and Carol. So thank you so much, Dr. Barr. I look forward to having you back and then getting into a discussion about peptides for women. Wouldn't
Thank you. Yes,
that
we'll
be
do that.
fun?
Thank you so much.
So thank you, and we'll be back next week.
Yes.
Bye-bye.
Thank you.
We'll be back next week. Thank you again.